Now, let's talk about stress at work. Do you experience stress in your workplace? After the pandemic, many people started working in hybrid way, with less time in the office and fewer commuting hours. So, has work become less stressful or more stressful? This week is Stress Awareness Week, focusing on mental health in the workplace. So, how employees are really doing today? Let's find out. NURSAFIYA HUSNA, Director of Healthy Leadership, join us now. Good evening, Safia. I'm guessing you don't experience stress at work, or do you?
Thank you for your question, AMIRAH. Yes, I do experience stress. Even though I am now retired, I still feel stress, and I definitely experienced it when I was working. Stress is a part of life and it cannot be fully avoided. Sometimes it is even a necessary part of work. However, when we look at today's working world and compare it to the time before the pandemic, we can see that people are actually more stressed now, not less. Research conducted last year and this year show that stress levels are higher than the year before the pandemic.
Yes, research shows that stress levels are increasing around the world. This does not only affect working people, but everyone. Stress levels are high than before the pandemic, and they are still not going down yet. Because of this, people's mental health and overall well-being are also declining. There are several reasons of this. One reason is global uncertainty, such as economic problems and ongoing conflicts around the world. Some stress is also related to work, especially with remote and hybrid working, which can make communications and support more difficult. When we talk about hybrid and remote working, stress levels can actually be higher compared to working in the office. This is because problems may be harder to solve when employees work remotely, and there is often less teamwork and collaboration. At the same time, workers may also face more pressure at home while not receiving enough support or resources from their workplace. For this reason, stress levels among employees remain high.
So, looking at the stress level across the board, the question is, what can be done to reduce workplace stress? This is a big topic and it has been widely discussed, especially after the pandemic. The way we work has changed dramatically for many people. Some were forced to work from home, which they were not used to, while others welcomed the change. For some, working from home has helped improve their work-life balance. For example, being able to pick up children from school and manage household responsibilities. But as we have seen, stress levels are still high. So the real question is, how can workplace adapt and support employees better while still maintaining productivity and a positive workplace environment?
Hello, I'm AISYAH, HR and Leadership Specialist. Thank you for having me on the show today. Stress level in the workplace have gone up, not down. So what can we do about it? From an organizational point of view, the first question leaders should ask is, what work do we need to do to achieve our goals? Then they should discuss with employees how and where this work can be done instead of imposing their own idea of flexible working. From an individual perspective, it's important for employees to take care of themselves, plan for their personal and family needs, and make sure they have support.
I think organizations also need to provide meaningful supports, not just general counseling. Employees like me should be allowed to take care of ourselves instead of ignoring their problems, because stress doesn't just go away on its own. Sometimes I wonder, are organizations really helping or just talking about mental health without taking real actions? Some managers do care and provide useful supports, but unfortunately it's very inconsistent. So, in conclusion, managing mental health at work is a shared responsibility. Employees and organizations need to work together to create a healthy, supportive, and productive workplace. Thank you for having us today. Assalamualaikum and good day everyone. Today, our group will be presenting on employees' mental health in Malaysia. These presentations will discuss the current situations, real cases, key workplace issues, the impact, and ways to prevent mental health problems among employees. So, mental health has become an increasingly urgent issue in Malaysia as more people experience stress, anxiety, and depression in their daily life. According to NHMS 2023, the rate of depression among adults increased from 2.3% in 2019 to 4.6% in 2023. Adults' mental health become problems include conditions such as depression, anxiety, and even suicidal behavior. This shows that mental health is a serious issue, especially among working adults.
This slide shows statistics on employees' mental health in Malaysia in 2024. The charts indicate that workplace stress mainly comes from organizational issues and heavy workload. Although many employees feel psychologically safe, stress levels and psychosocial risks remain significant. This shows that mental health challenges in the workplace are still a concern.
So, these slides present a real cases involving a trainee doctor at Penang Hospital in 2022. The doctor reportedly complained about being overwhelmed with work before the accident. This case highlights how work pressure and workload can seriously affect mental well-being, especially in high-stress professions. It shows why mental health issues among employees must be taken seriously.
Next, we have key factors of workplace issues. There are 4 key factors contributing to workplace mental health issues. First is poor workforce management, where unclear schedules and poor task organization increase stress. Second is lack of mental health support, making employees feel unsafe to speak up. Third is toxic organizational culture, such as strict hierarchy and harsh treatment. Lastly, inefficient staffing and placement cause employees to become overworked and exhausted.
This workplace issue can lead to a serious impact. First, poor workforce management increase a burnout, stress, and the risk of errors. Second, inefficient staff and placement result in work overload and longer waiting time. Third, lack of mental health support can cause unmanaged anxiety, depression, and risk of self-harm. Lastly, toxic organizational culture also affect teamwork and communication.
To prevent mental health problems in Malaysia, organizations should create a supportive and safe work environment. This includes reducing excessive stress, bullying, and discrimination. Promoting work-life balance through reasonable working hours and flexibility is also important. In addition, preventive mental health services such as mental health check-ins and stress management program should be provided. Thank you for listening to our presentation. Let's make mental health a shared priority because a healthy mind leads to a productive workplace.